Traction block instructions. Step 1. Warm your neck muscles prior to doing traction by using the neck stretcher for a few minutes. Step 2. The cervical traction device should be placed on a flat, firm surface, such as a wooden floor or tile with your foundation traction mat. It will not function effectively on soft surfaces, like a bed or carpet. Ensure that your shoulders rest against the side of the device marked shoulders side, right here. Step 3. Gently lie back on the device, positioning it behind your lower neck and the upper back. Your head should be close to the ground, but not resting on it, allowing for optimal neck traction that encourages the normal neck curvature for the best results. Step 4. Begin with a 1-minute session on the first day. Increase to 2 minutes on the following day if tolerated. Gradually extend the duration of use in small increments. For optimal results, you can extend the sessions to up to 30 minutes every day, as long as you remain comfortable. If lying flat causes any discomfort, consider bending your knees. Step 5. To conclude the session, roll onto one side smoothly to remove the device without lifting your head, ensuring a safe and comfortable transition from the traction session. Step 6. After removing the device, relax with your head resting on the ground to allow your spine and muscles to adjust. Take a moment to rest before sitting up straight to prevent dizziness or muscle strain. You can use a heating pad afterwards for 30 minutes to reduce soreness and improve circulation for better health. Thanks for watching. Any questions at all, let us know on your next visit.